Hi, everybody. This is Giselle. I am presenting on the community nursing practice model. And at the center of my concept map, I have the school nurse's role in caring for the teenage student population. In this presentation, I'm going to talk about the four themes as well as the individual parts of my concept map and how they relate to this practice model. So, the four interrelated themes in the community nursing practice model are nursing, person, community, and environment. Regarding nursing, this part really touches on how unique each nurse is and how he or she may perceive things depending on their past and present experiences. Um, with the person, it regards the patient or the client that's being addressed at the time, and that they are just as unique as the nurse, and that the nurse really needs to continue to adapt and learn from the person, and also that you may never really fully comprehend what's behind somebody, but that you're always willing to learn and grow as you get to know these people better and better. Regarding the community, it is a nurse's ability to really see past the person in front of them and really see the area, the influences around them. And that kind of pertains to the environment as well, the surroundings, and knowing and appreciating really how people, the person that you're taking care of, interacts with this environment and the community. The first part of the concept map that I'm going to talk about is the nurse's duty in collaborating with the individual student, the community, and other professional providers, and how these really tie into the values of essentiality, community participation, and intersectoral collaboration. In collaborating with the individual student, a nurse is able to ascertain what the student wants as well as what the student needs. Together, they work to resolve different issues that the patient may have. When a nurse listens to the community and is aware of the availability of different services or the lack of services, and then finds a need to drive some change to provide those services, the nurse is using the value of community participation. And in intersectoral collaboration, it's really about knowing your limits and what you're capable of doing and how you can help other providers for the sake of the student. So, in working with not only teachers, as in this case, a school example, but also social workers, doctors, psychologists, coaches, working together to really benefit the student. The next nursing action that I'm going to talk about in this concept map is the nurse's ability to identify with individual driven solutions as well as the problem. When someone feels empowered to drive their own solutions and collaborate with their nurse, it really helps them comply and understand the reasons behind their treatment or doing what's best for them. Rather than being told what to do, when they help come up with the answer, these patients really feel like they have the control and seem to have a better understanding of what's going on. When a nurse identifies with the problem, just by asking somebody, what is going on, or how can I help you, it really helps a nurse capture the point of view and gain the respect of a patient. Many times, regardless of whether it's a school nurse or in other situations in nursing, we find patients that are doing things because they're told they have to do it, or they don't really understand why, and they're just kind of going through the motions, a little confused. And again, that goes with empowerment. That once you can really identify the problem from the patient's point of view and help resolve things, again, with what they're driving and what's important to them, they're more likely to comply, more likely to understand, I'm more likely to feel respected and really gain trust with this healthcare worker, whether it's a nurse, doctor, and it could not be a healthcare worker, a teacher, a guidance counselor. Along with identifying with individual driven solutions, as well as the problem, is a school nurse's ability to identify with the individual. When you identify with the individual, I think you're really able to apply two different values of the community nursing practice model, those values of caring and wholeness. When you identify with the individual, you're getting insight into what makes them them and who they really are, and looking past what's in front of you and getting more of a picture from what they're telling you and also from what you can pick up. I thought this picture was really great. It's a bunch of teenagers who are dressed up as their specific stereotypes, but that they're not that. They're more than that, or they're totally not that at all. Um, so I thought that this picture really helps depict that. And in addition to just caring about them and putting in the extra effort to learn and grow with them, you're really seeing more than themselves, but also that they're not just the person on the inside. They're the person on the outside too. They're their friends. They're their parents who are fighting at home. They're the volunteer community that they teamed up with or influenced by. So I think identifying with the individual is probably one of the most important things. And you see that within this model, it deals a lot with seeing people for who they are in addition to what their community or what their surroundings really bring. The final portion of my concept map that I'm going to talk about is the nurse's ability to develop student and community specific programs, and how this really touches on the access portion of the community nursing practice model. When a nurse listens to what her students and the community really needs, he or she is able to develop programs that are unique to the community, whether it's regarding teenage pregnancy, drug use within a high school community, or maybe even emotional counseling if there's a high divorce rate or a high rate of bullying. Um, when a nurse really listens to what's needed and what's lacking, and what the students really are suffering from, they're able to appropriately develop these programs and help the community overall. This concludes my concept map presentation on the community nursing practice model. Thank you so much for your time and attention. I wish everybody a happy holiday. And I'm sorry I wasn't in class that much this semester, but it's really been a pleasure interacting with everybody online and reading everyone's threaded discussions. It's really been a great experience working with everybody. Have a happy new year. Thank you.